Right, so we are officially unveiling the curtain, and our public guests are coming in, and I can work on promoting people who might be on the audience side into the panelist side later on, if they're not already here. But I did give some folks the panelist rights, so they'd be able to share their screens right away if they needed to.
Well, terrific. Well, we might as well go ahead and get started. And I am Jess Maurer. I'm the Executive Director of the Maine Council on Aging, and I am the, chair of the Essential Support Workforce Advisory Council. I had to remember all the words in the right order. I'm joined today by Catherine Thibodeau, who is the Vice Chair of the board. And we'll start with committee, and we'll start with just a brief introductions of committee members. Why don't we start with you, Stephanie?
Good afternoon, I'm Stephanie Hatter. I am the Director of Training and Onboarding for Northeast Residential Services, and I am a member of the committee as a direct care worker.
Terrific. Mary Jane.
Hi, I'm Mary Jane Richards McDade. I am the CEO of North Country Associates. I'm a board member of Maine Council on Aging and happy to be here.
Great. Catherine?
Catherine Thibodeau. I'm the Executive Director of Independence Advocates of Maine. Serve as Jess noted, as the Vice Chair on this committee, and I'm here representing providers of disability IDD services.
And Michael Smith.
Good afternoon, Michael Smith with Catholic Charities Maine, Chief Program Officer, and for this committee, serving for the ISS Independent Support Services, or the Homemaker program.
Terrific. And then we've got several invited guests today, and I will start with Paul Saucier.
Good afternoon, Paul Saucier, Director of the Office of Aging and Disability Services. Glad to be with you today.
Thank you. And Jamie.
Good afternoon, Jaime Brace. I'm the Director of Workforce Initiatives through Office of Aging and Disability Services.
Thank you. Arthur.
Thanks, Jess. Arthur Phillips. I'm an analyst with the Maine Center for Economic Policy. Good to be here.
And Renate. Well, for some reason, we can't hear you. Still can't hear you. We'll come back to you in just 1 minute. Bev.
Hi, folks. I'm Bev Uhlenhake. I'm a government affairs consultant at Pierce Atwood, representing the Maine Association of Personal Care Agencies, and I will be joining you on camera as soon as I get back to my computer and my desk. So,
great. Renate, how you doing?
I don't know. Can you hear me?
Yes.
Turns out I have like 6 options to pick from. So Renate Schultz, I'm the owner of the Homestead franchise in Gorham, Maine, and also the chair of the board of the newly founded Maine Association of Personal Care Agencies.
Great. And now we're going to go back to committee members and introduce Kim Moore.
Sure. Sorry. I'm Kim Moore. I'm the Director for the Bureau of Employment Services here at the Maine Department of Labor.
Thank you. And then now we're going to go back to visitors and Brenda.
Hey there, I'm Brenda Peluso, and I am the coordinator of the Essential Care and Support Workforce Partnership, and it's so nice to see all of you.
And Nichole.
Good afternoon, I'm Nichole Marchesi. I'm the Public Policy Advocate for the Maine Long-Term Care Ombudsman Program, and I'm sorry I'm a little bit late today.
You are fine. And Angelina, where'd you go?
Hi, I'm Angelina Cluthis-Jean. I work for the Maine Department of Labor. I serve as the Director of Strategy and Innovation in the Bureau of Employment Services. But today I am your tech support. So if you have any kind of technical needs, you want to share your screen, you've got some kind of hiccups, please reach out to me. I will be standing by to help.
Fantastic. And we did hear from a number of folks who were going to be unable to join us today. And in addition to that, we have a couple of positions that we need to fill on the committee, including our 2 legislators. And we have an agreement from Holly Stover to serve as the new House chair or participant on the committee, and are still seeking a senator. So we will keep you updated on that process, but they have to be appointed by the Speaker of the House and the Senate President. So there's a little bit of a lag in those situations. And we also have heard from folks who really want to come, but they have a conflict and would love to be able to send a surrogate. So we thought we would ask the question whether folks would be okay with a designated surrogate coming, and we wouldn't have to have them vote if we were going to take a vote on some sort of action. We could use email with the person who's actually appointed, but could have someone sitting in their seat if there's a conflict who would still be able to participate. So just really would be interested in hearing committee members' feedback on what they think about that proposal.
If that's something we're allowed to do, I'd be in favor. Because I see it as a standing seat from a organization and or particular viewpoint that we're trying to make sure it's represented at the table. So absolutely.
Yeah, I agree.
Any concerns? Oh, maybe we'll do it that way. All right, if there's no concerns, then we'll follow down that pathway. I do want to also note that Angelina circulated our report that will go to the Health and Human Services Committee well, it's already gone to the Health and Human Services Committee, sorry. I think there was some technical issues early on, but I just want to thank Angelina for putting the report together and doing it literally on time so that we actually met the deadline for the first time. in I know exactly, she rocks. And you all were really great in responding in late December. And so just wanted to thank you all. Last year, we provided the report to the Health and Human Services Committee in person. Catherine and I did, and just wanted to check in with folks to see if that was something that we felt like we wanted to do again this year. That was a question mark.
Well, I think it's.
Did you find a lot of value add last year, Jess, when you did that? I mean, were there questions answered? Were you able to add in more by your presence being there, or is it? Then that seems huge to me. If you could do that again, yeah.
I guess my perspective is I feel like this committee really works really hard and has invested a lot of time, and it's a nice opportunity to kind of share that with the committee and allow for that opportunity, like Michael said, for questions. So I would support it.
Any opposition or concerns? Okay, hearing none. Thank you for that. And so just before we get started into the main part of our conversations, I always like to start our meetings with just a brief reminder of what we are doing. So we're a statutorily created committee, and our duties include collaborating with Department of Health and Human Services and Labor to examine the staffing level needs of the essential support workforce, including entities funded through the state and MaineCare, to make recommendations to state agencies and the legislature related to recruitment and retention of essential support workers, monitor essential support worker shortages, and the expansion of the essential support workforce, to examine if actions taken to promote the expansion of the essential support workforce have been successful, make recommendations to the Department of Labor, Department of Health and Human Services, the legislature, and other state agencies regarding additional research needed to further the expansion of the essential support workforce, collect data related to the essential support workforce, examine benefits cliff effects on essential support workers, and recommend and develop a pilot project to mitigate benefit cliff effects on essential support workers, and make recommendations to the legislature, including any suggested legislation. So in relation to that, last year we did, I just was sort of the last update that I'll offer, and then we'll move into the current landscape. We did make a recommendation that we put in a bill that would have the Maine Health Data Organization essentially look at all of the data sources available, both in state government and through the provider network, to be able to put together a comprehensive care gap report year over year, to in fact determine whether what we're all trying to do in various ways, shapes, and forms has been effective. So whether the care gap is growing or whether the care gap is actually contracting. That died a death like all other deaths at the end of last session, and just wanted to say that we recommended again in December, that, or in our last meeting, whatever that was. I've lost the plot on that one. We recommended again that also move forward, and so we have included that in an omnibus bill, that same exact language. And in addition to that, and I understand that Representative Clucci has also put in a standalone bill on that issue in particular, and so have sort of two opportunities to move that forward, and that's a good thing. Also in the omnibus bill, as we discussed at the last meeting, we have included a recommendation that the committee be expanded to include a representative from a personal care agency and also a representative from the Maine Long-Term Care Ombudsman Program, very specifically because they host the worker council. And in addition to having a worker here, we also want to make sure that we are as broadly as possible, including the voices of workers. So that's all I have as a committee member by way of update. Do any other committee members want to offer any updates related to our work before we go into our formal agenda? I'm just playing the Jeopardy song in my head, just in case anybody was curious. All right.
Yes, I'd be more impressed if you really had it on in the background.
Oh, next time, Michael. Next time. And I just wanted to acknowledge that Dawn has joined us. Dawn, would you like to introduce yourself, please?
Yeah, sorry I'm late. The storm today pushed everything on a domino effect. I'm Don Dufour, Senior Director of HR at Spurwink. I was previously the Chief HR at Tri-County Mental Health.
Great. Nice to see you.
Thank you.
So I think that will conclude the updates. And what we have asked, we've asked several folks to come today to share some updates with us about this workforce. And as we have in the past, I just want to I want to like a little kind of cool acknowledgement that we now have 18 interested parties who are signed up, which is great. I don't know that they're all here, but as we have done it in the past, we will really kind of at the conclusion of big chunks of presentations today, after the committee has had an opportunity to ask questions and explore any options, we'll also then open it up to the public for public comment, and we'll do that at each intersection. So just wanted to acknowledge that there are potentially, I haven't checked, but there are potentially people out there paying attention to this committee meeting that are not inside of this webinar. So thanks. So the first speaker that we've asked to come is Brenda Peluso, who is leading the Essential Care and Support Workforce Partnership, and she's going to provide some updates in relation to the conclusion of some working groups that were working all last fall on various issues, as well as a piece of legislation that has been put forth. I'm going to turn things over to you, Brenda.
Okay, thank you. And Angelina, can I share my screen?
You should have the power.
Okay, let's
If you
see.
don't,
Yes, and I'm going to turn this into a slideshow, hopefully. Great. So, parts of this, the beginning part of my presentation, will cover some stuff that I shared with the committee. So, at an earlier meeting, I think back in August, maybe, last year. I'll go quickly through that, and then I know after following me is Arthur and from MECEP, and he's going to be giving some more details on some of the things I reference. So quickly, the partnership is it's sort of a formalized version of coalitions that have happened in the past. We're in year 3 right now of a 3-year grant to work really intentionally to increase access to quality direct care and support in Maine by changing the way that we value the work, the workers and the work that they do. We have and we have an advisory council that helps drive our work, and these are the members of that advisory council. And then at the last meeting, we showed you this screen that since 2019, some of the things that we have managed to get through at working in coalition. So there was a commission report that came out in 2020 and created this, this commission, right? Studied the long-term care and they issued a report. The ESWAC committee was formed in 2022. We set legislature rates at 125 above minimum wage, and we the long-term care ombudsman program launched the Worker Advisory Council. And then we, in 2023, MECEP, Maine Center for Economic Policy, issued their first report on the workforce, and a bunch of other work happened. Universal worker credentialing was started. And then the last 8 months, I came on in July of last year. And the last 8 months, we held the June summit where we brought together all the partners, and we released a report in August of the recommendations that came out of that. We formed 3 working groups in October. One working group was looking at wages and benefits. Another working group was looking at utilizing technology in order to bridge the gap in the direct care workforce. And a third group was looking at streamlining credentialing and training in order to help workers move between settings, help workers more readily upscale, and sort of decrease those barriers to joining the workforce. In December, the working groups and this committee had some recommendations released. And then in January, Speaker Fecteau submitted an omnibus bill. And in that omnibus bill, Jess already outlined the 2 pieces that came from your committee, what we call the ESWAC committee, or the LD 898 committee. But from the working groups, from the partnerships working groups, part 1 looks to increase the reimbursement to providers for the labor portion of the main care rates to be be at least 140% of minimum wage. And it also sets a floor so that no worker is paid less than 125%. And then part 2 comes from the utilizing technology working group. And it requires the state to lead a stakeholder process to produce an innovations in care and support technology plan by October 2026. And then part 3 comes from the credentialing and training working group. And we have already started. I'm grateful that Paul Saucier and Jamie are here. We've already started working with the department, which is great. We've had one meeting to really dig into their plans for universal standard core curriculum and what their plans are going forward after this initial round of consolidation, which I'm sure they'll be talking about. But this part of the bill tries to create a structure that we can all work together to get to the final outcome and in as short a time as possible. And then 4 and 5, these are from what Jess Maurer just talked about. And part 6 requires the state. This part here is addressing the fact that we don't know how much it would cost to budget appropriately to cover all of the Maine Care approved services that are out there. Right now, we budget based on previous year expenditures. And as we saw this year in the supplemental budget, we've been somewhat successful in growing the workforce. Therefore, more people are getting care. Our population is aging. And so what this part of the bill is looking to do is to ensure the state, that they're going to have to do some data. They're going to need to look in, and this one is they're going to have to figure out how we can, sorry. We know that, so right now, for instance, we know that at least 23,500 hours of approved care on each week in one section of Maine Care go unfilled. So we are not budgeting if we had enough workforce to provide those hours of care. We're not budgeting for that cost. We're budgeting based on prior years. So this provision would require the state to study sort of what is the total biennial cost for the state to provide all currently approved Maine Care and state-funded services for older people, people with physical and intellectual disabilities, and people with behavioral health challenges. And either whether they're at home or in residential settings. It would also require the state to forecast to anticipate future costs as our demographics change. So I hope I explained that in a way that made sense. We've done a blog post here on the different parts, more detail about the different parts. Of course, the bill hasn't been printed yet. So once it's printed and we have the exact language, we will follow up with more information about each piece of the bill. Then, so other stuff we're working on, I'm just going to touch briefly on these because I think Arthur's going to get into them more as well after me. But the cost of living adjustments that were part of the rate setting system that was set when we, back, I think in 2021, requires that wages be, the reimbursement rate be changed at the same time as minimum wage goes up. And in January, providers were expecting to receive cost of living adjustments in their reimbursement rates. However, in late December or early December, the administration said that these will just not be happening. And because of the fear of how expensive that will be down the line. And again, this sort of leads back to if we don't budget appropriately for being successful in investing in the workforce and because of our aging demographics, we're going to be coming up against this over and over again. And so we were active in the supplemental budget. We're going to be active in the biennial budget as well around the COLAs and some language changes that have been proposed. And then we're also just mentioned one other bill that's been put in, and we're tracking other related bills beyond the speaker's bill. And so timeline estimates, these are just guesses. We know this is what's happening at the legislature for supplemental and the biennial budget, and then not sure when the omnibus bill will be coming out. So my confidence level on that prediction is about 30%. Then I'm not sure when you're going to be offering questions, now or after Arthur. You're muted.
Thank you. You want to stop sharing your screen?
Yes, good idea.
Thank you. Do any of the committee members have any questions for Brenda? Do any of our visiting guests have any questions for Brenda?
I was wondering, Brenda, if you could put, I'm not a visiting guest, but I was wondering if you could put that link to the blog post in the chat, if that's possible.
Absolutely. Mm-hmm.
Great, I appreciate that. Thanks.
Yes.
So we're going to hold off on public comment until we finish with both Arthur and Paul. So at the next, because these are sort of one big combined sort of updates. So the next presentation will be from Arthur Phillips, who is an analyst with the Maine Center for Economic Policy.
Great. Thank you, Jess. Thanks, Brenda. I'm also going to share my screen. Just a moment. All right, can folks see that? Great. So I was invited just to give a bit of a snapshot on the direct care workforce landscape, which I'm going to do pretty quickly here. I'm going to just touch on some material that some of you have seen before, but not everyone. These are kind of the 30,000-foot findings from our 2 reports in the last 2 years. The first of which was really about the broad economic costs of the direct care workforce shortage. And the second of which was an attempt to estimate the scale of the care gap and how many more workers we need to bridge that gap and what it might take to get there. And then lastly, as Brenda suggested, I'm just going to speak very quickly to the current issues going on with the cost of living adjustments in the supplemental and biennial budgets that are being deliberated on right now.
Hey, Arthur. You're not sharing in presentation mode, but you're sharing in presenter mode, so we can see the slide that's coming. Okay. There you go.
Great.
Thank you.
Let's see. How does that look?
That's just in the regular, not in presentation mode, just in slideshow mode. And I think that's less distracting than the other one, but.
Okay. Thank you for letting me know. This is great when this happens when you're presenting over video.
It is. It's fun, isn't it?
Yeah.
It might have been like the screen you were showing if you have multiple screens.
Oh yeah, that might be it. Excuse
Yeah.
me.
I think that's probably it. Yeah.
Might have happened to me a time or two before.
Might have. Yeah.
Okay. Thanks for bearing with me, folks.
We're a friendly crowd.
Does this look any better?
Beautiful.
Yes.
Okay, great.
Good work.
Thank you all for bearing with me. So the first report that I mentioned came out in 2023, which was really an attempt at looking at how low pay and poor benefits have led to high poverty, turnover, and burnout among direct care workers. And it looked at the economic impacts on providers, consumers, and family members, and how these impacted Maine's workforce, public revenue, and economic vitality by limiting people's ability to participate fully in our economy. Some of the main findings of that report were that approximately 8,000 workers were out of the labor force due to care responsibilities for an older adult. We recognize that the scope of this work is not only focused on older adults, but because of some of the data that was available to us, that was a very relevant finding. We estimate that the economic impact of this workforce shortage, it leads to a loss of close to $1 billion in state GDP and a loss of state and federal revenues combined of around $70 million a year. We also recognize, although have so far had a harder time quantifying how many more workers who are in the labor force are impacted by juggling their paid work responsibilities with their unpaid care responsibilities. So that may be an example of someone going from full-time to part-time work, or just being stretched thin and having less capacity to do their jobs than they might otherwise. Following up, we came out with a second report last year in June, which was titled "Closing the Gap: Maine's Direct Care Shortage and Solutions to Fix It." And the goals of this report were really to add to existing efforts to measure gaps in care, including approved care that was not being delivered, service gaps, vacancy rates, and declines in facilities and bed capacity. We strived to approximate the number of additional workers that are needed to meet the current demand for approved services, and to propose an estimate of a competitive wage to attract and retain more workers in the field. So just very quickly, some of the findings from that report. As Brenda mentioned, I think more than 23,000 unstaffed hours per week for older people in need of home care through Maine Care and state-funded programs. About 2/3 of that was direct care, personal care services, and about 1/3 of it was nursing services, I believe. We also highlighted the number of nursing home closures, which between 2010 and 2023 amounted to 19% of our nursing homes closing, more than any other state in New England, and compared to about 5% nationwide, with staffing challenges being a primary driver. We found that among behavioral health providers, we received data from a survey of 50 organizational respondents, had nearly 9,000 clients that were waiting for mental health counseling for an average of 32 weeks, many of them waiting for much longer periods than that to receive the counseling they need. And in IDD supports and services, a survey of providers there showed significant staffing shortages in each service area, which was impacting their ability to provide services. All told, we found that there's a need for a minimum of 2,300 additional direct care workers to address the existing known need for approved care. Of course, this gets at there are things that we don't know about. There's care that has not been approved that is needed, but I think that we can, based on the information that we have at hand, we can safely say that that is kind of a snapshot of the direct care workforce shortage. We also know that demographic trends point to a much greater need in coming years. And because of high turnover rates, particularly in this sector, we've estimated that there will be around 35,000 total job openings this decade. I think that's a conservative estimate, but I think it underlines the fact that we both need to grow the workforce and, crucially, we need to retain the workforce that we have. That is a really huge part of the challenge that we face. We've also noted that wages are the top issue for direct care workers or direct care professionals. The Essential Care and Support Workforce Partnership that we're a member of conducted a survey of just over 300 workers. And when given a menu of, I believe, 5 different options, nearly 2/3 chose fair pay as the number one thing to attract workers, more workers into direct care. And a similar proportion identified fair pay as the number one thing to retain workers in direct care. Looking back at the Long-Term Care Ombudsman's program in 2021, a survey of more than 700 direct care workers reported that most found that their pay was not commensurate with the difficulty and importance of their work. To really quickly look at our wage analysis, we relied on PHI's state index, which found that as of 2022, Maine's direct care workers earn an average of $1.92 less per hour than workers in occupations with similar entry-level requirements. This was actually an improvement from the previous year. And 2023 wage data, which showed that home health and personal care aides in Maine had lower median wages than cooks, customer service representatives, janitors, secretaries, and social and human services assistants. So I think that just coming back to this slide, or staying on the slide for a moment, I think it demonstrates that the state has made some significant progress, has really invested in really significant endeavors to raise wages. And those have been impactful and certainly helped with some rebound from a significant decline in employment after the pandemic set in. However, because of the tight labor market that we're also aware of, and because of, I think, the ability of private sector employers to adjust perhaps more swiftly to that changing labor landscape, workers in other similarly situated occupations in the private sector in particular have seen decent wage gains at the same time, and in some cases, higher wage gains, which make it really imperative on the state to find ways to reach a competitive wage for direct care workers whose wages are really largely determined by rates set by the state. So coming out of this work, we propose some recommendations, which probably sound familiar to everyone watching or listening to this. We recommended to raise reimbursement for the labor portion of direct care in all settings to at least 140% of the state minimum wage, to elevate direct care access and workforce issues in Maine's economic development priorities, which I think really is a reflection of our findings on the impact that this workforce shortage has on our economy throughout the state, really wanting to elevate that as a goal for economic development in the state more broadly. We'd like to see improved data collection and reporting, and we'd like to find creative ways to track and report the health outcomes of people who are not receiving any or all of their approved care. So I want to very quickly talk about the proposed budget cuts. These are both in the supplemental budget, which would cover the final 6 years of, the next 5 months, the remainder of fiscal year 2025. As Brenda, I believe, mentioned I think on December 2nd, 2024, DHHS announced that direct care providers that were expecting a cost of living adjustment on January 1st would not be receiving them. There's the list of sections are in that bullet point that would be impacted. Last Tuesday, or a couple of weeks ago, there was a hearing, a joint hearing with the AFA and HHS committees that were reviewing the supplemental budget, heard from a lot of providers and advocates and impacted people about what this means for their budgets and their ability to provide and receive the care that they need. There was a work session in HHS on the supplemental budget last Tuesday, where we received a little bit more information, and that committee unanimously recommended implementing partial cost of living adjustments as soon as practicable. And we will see whether that is adopted into the supplemental and whether the supplemental can receive 2/3 support in the legislature and thereby be implemented immediately, which would hopefully speed up those cost of living adjustments. I want to point then to the biennial budget, which I believe right now is maybe the second hearing on which will take place over the next 3 or 4 weeks on the biennial budget. We see that the proposal is to freeze cost of living adjustments through the next two years, beginning July 1. The department, I believe, estimated approximately $132 million in savings to the state over 2 years. We at MECEP estimate that if passed, this could reduce wages for each worker by an average of $1,690 per year by 2027. And we also find that we believe that more than half of all cuts that are proposed in the biennial budget are accounted for in the proposal to not implement cost of living adjustments for Maine Care Services. And so, you know, we recognize that we're in a moment where there's a structural deficit, and we also recognize that the administration is facing significant pressures to live up to its commitments to fund Maine Care, expanded Maine Care, and that those are really important priorities. However, speaking for MECEP, and I think lots of other folks would probably not disagree, I think that the scale of the cuts in the biennial budget falling directly on Maine Care Services and in particular on a workforce that we find is really critical infrastructure for the functioning of our state and for the health of our people. We would, we're very adamantly proposing that the state find alternative means to find the revenue to fund these cost of living adjustments, and in fact go further. Again, we recommend that there would be significant benefits of raising reimbursement rates rather than in this proposal freezing them for direct care work. So I know that was a lot, some of which was familiar, but I just want to leave it there and I suppose open it up to any questions that folks may have.
You want to stop sharing your screen, Arthur?
Yes. Suppose I do. Thank you.
You're welcome. Any committee members have any questions for Arthur? Catherine, I saw you come off.
Yeah, I was going to chat to you, Arthur, but I'll ask it. On that supplemental budget list of sections of Maine Care, I didn't see that you had section 50 listed there, but that was my understanding too, that they did not receive a January COLA. That's the ICF program. So I don't know if that's something we could get some clarity on. I mean, I was on vacation last week, so I'm still just sort of catching up on things.
Catherine, thanks for raising that. Let me go back and confirm, and I will, if it's all right with you, maybe I'll get back to you over email with whatever I learned.
Yeah, that would be great. Thanks. I had another question too. On the slide that showed, it showed improvement on the wages, the wage gap for employees. And I think it was 2021 and 2022, maybe, or 20. Is that something that we can get continual data on that to see? I'm just interested to see what the subsequent years showed, if that continued to show an improvement.
Yeah, absolutely. When it's a slightly delayed analysis, just because it's kind of taking one data set and coding it in a particular way to adjust for the entry, kind of the characteristics or entry level requirements of that kind of work, generally speaking. And so I'm eager to find that update. It's promising that we saw the improvement from one year to the next, and we'll be interested to see what kind of trend there might be there.
All right, great, thanks.
Any other questions for Arthur? Hearing none, we're going to turn
Arthur,
to Michael, please.
Sorry, I found the slide interesting on the sort of put some evaluative component to those that are not being served. Do we have, is that more just theoretical, or do we even have anyone that's going to own that or process through which we do that? Because that would be pretty interesting information to gather. Did I interpret that slide incorrectly, maybe? But
Michael, you're talking about the idea of being able to track the impacts of those who are not receiving all the care for which they're approved, I think is what you're reacting to. And
yes,
I don't think there's any short answer to that question. I think that that will require a lot of stakeholders and people with different kind of technical abilities to do that. So I think that that's a bigger conversation. I hope it's one that we can pursue.
I can say we had that conversation, and I see you, Mary Jane, we will move right to you. I will say that we did have that conversation with Karen Lee, who's the head of the Maine Health Data Organization. And she was saying that's certainly something that would be possible, but it would be like many iterations down the road in relation to because they can use claims data. It's really some of the work that they do in relation to quality, right? And so, you know, understanding, and it's certainly something we have talked about, right? Understanding what's happening to people who aren't getting care, and how are we, you know, how are we spending more money or not accruing as high a return on investment. We could put it in that positive, right? That we could be by utilizing lower cost types of services and avoiding hospitalization and other kinds of essentially what would be avoidable healthcare costs. But we don't know the answer to that question. We have only anecdotal data. We'd have to look behind the curtain, which would be a whole different thing, but that's the kind of thing they do.
Great, love it. No, I just appreciate the context.
Great, Mary Jane?
So I just wanted to comment on, I don't really have a question, Arthur, but thank you for presenting. Though the challenges for nursing homes and assisted livings right now come with the uncertainty about heightened regulations regarding the amount of staff we need to cover our facilities, especially RNs. So without getting that 125%, that's going to be a challenge. And then secondly, we have new regulations coming, and Paul can probably speak to this, through our PNMIs that are going to require a higher amount of staff, which, again, we're not getting the COLA. We have no additional funding for those programs. And I suspect it's going to create the same effect that it did on nursing without getting those things. And there'll be a number of assisted livings closing because they can't meet the staffing requirements.
Yeah, thanks for raising that, Mary Jane. I think that, I mean, I've just heard so many stories about the impacts of short staffing, and I you know, this kind of economic analysis that we do is not to suggest that there's some silver bullet to these really complicated problems in a big spread out state with lots of workforce challenges in a lot of different areas. But I think it's safe to say that there needs to be sufficient staffing in nursing homes and PNMIs and in all settings. And I think that a critical piece of being able to do that is to be able to offer a competitive wage, which is kind of what the basis of what our second report was really driving towards and trying to help uncover and identify. But certainly not lost on us that if there is a failure to update to implement COLAs in the coming years, those are going to be hard things to meet.
Thank you.
Going once. All right. Great, thank you, Arthur. And now we will turn to Director Saucier for any updates you would like to offer and help us with a sort of current landscape understanding. Thank you.
Sure. And I think we didn't plan it, but I think my comments will really complement Arthur's here, because from my perspective, the biggest challenges right now relate to the uncertainty around federal policy in a number of areas, Medicaid in particular, and the very significant downstream impact that would have on Maine and Maine providers. The grant freeze fiasco that we all experienced last week was really perhaps just a small example of the seemingly random risks that we run now, and just not knowing what the new administration might do. And that one seems to be on hold for the moment, which is good, because that would have impacted essentially our entire social services network. But the more concerning thing, because I think it's more real, so I realize I'm editorializing a little bit here, just bear with me. The House Ways and Means Committee has been working on a number of Medicaid savings to offset whatever might go into the reconciliation bill that Congress is working on, and they would all have very significant impacts. I really am focused on Medicaid because it's already extremely important in Maine, and you know, we're fortunate that we do have a general fund program on the aging side that also provides some services to people who are not Maine Care eligible. But you know, the big money is what Maine Care spends on long-term services and supports. In the aging and physical disability realm, from 2019 to 2024, our Maine Care expenditures went from $550 million to $788. So $788 million on aging and physical disability in the last fiscal year. In the IDD space, it went from 557 to 830. So, you know, 830 million in Maine Care. When you add those two together, LTSS is $1.6 billion in Maine, of Maine Care money. And, you know, this is not exact math because they didn't have the exact match rate, but about $1 billion of that is federal and about 600 million state. So when you think about that, I mean, it's a big number no matter how you think about it. People like to say Maine Care is all federal or whatever, but I mean, there's a large match component that is required. Maine has done a great job growing that over the past 5 years, but it's all at risk right now, depending on federal policy. So the first big policy idea coming out of Washington is a very old idea. I mean, those of you who, like me, were around in the Reagan years remember the block grant proposals. So there are variations on block grant. It seems like their per capita caps is what's favored, but they would result in significant cuts to states. Essentially, Medicaid would be transformed from its current entitlement program, where if Maine spends the money, we get the federal share, to a set amount per person in Maine that we would get from the federal government that we would have to live with. Again, if it were the same amount of money, but just more flexibility, that would be one thing, but it would definitely be considerably less money. They're also considering reducing the FMAP rate. That's the federal Medicaid medical assistance percentage, the amount that the feds put in. They're considering reducing the FMAP rate for everybody. They're considering removing the 50% floor. That would not affect Maine because we're more than 50%, but it would affect the big states like New York and California that get 50% match. And they're also considering getting rid of the special 90% federal match for the expansion population, which has been very important to Maine. So big cuts there as well. There's talk of limiting provider taxes and disproportionate share hospital payments. Those are both very important in Maine and used. We use the provider taxes with nursing homes, with hospitals, et cetera, to essentially raise more revenue for the program. And then at the beneficiary level, work requirements, I think, would largely not impact the group that we're talking about here today, because pretty much all the proposals I'm seeing are exempting people in eligibility or age-related Medicaid categories. And so I don't think that would have a negative impact, but certainly not on the populations we're discussing today. But more frequent eligibility verification would, and of course that would be a lot more work for providers because they'd be chasing down eligibility more frequently for the people that they serve. So these are very big threats in the environment that are, as I say, from my perspective, we have to take seriously because they are being prepared as potential offsets in a reconciliation bill that the Congress could pass with majority vote. So I definitely encourage you all to stay tuned into the debate and the discussion and do whatever you need to do or can do to help preserve Medicaid. Also on the House Ways and Means list is repeal of a couple of recent rules. Now, these, I have to say, probably cut both ways a little bit. Mary Jane referenced the nursing home minimum staffing ratios. That is definitely on the repeal list. From my perspective, Mary Jane, it doesn't have a huge impact in Maine because we're already funding nursing homes at a higher direct care percentage, hours per resident day, than the federal minimum. However, I understand that that rule would cause real problems with nursing coverage at night and on weekends. So I imagine the provider communities would probably welcome a repeal of that rule, but that's on the table. Also on the table is repeal of the access rule. Again, probably a mixed bag from your perspective. If you're a home care agency, I know we have some home care folks on the line today. That means that 80% rule, that you have to spend 80% on direct care would go away, which I imagine people would be happy about. But if I think that rule was intended to help workers. And so if that's repealed, that goes away, along with lots of new transparency requirements. We're doing some hard work on the access rule right now, and we intend to move forward with some of it, whether it continues or not, because we think a lot of it is just good policy. But nonetheless, that's on the list of things to repeal. And then you've got a couple of other big things in the environment that I think probably one cuts each way in terms of workforce. Immigration actions obviously already having a lot of negative impact on our workers in our system. I've heard from some workers. We have relied increasingly on new Mainers as direct care workers, and there's a lot of fear out there. We haven't heard about any Maine specific actions yet, but we are definitely hearing a lot of fear coming from the workforce. And then the tariffs, most economists are predicting that will bump up the unemployment rate a bit, which I suppose you could say would be a silver lining because people would be looking for other work if they're displaced from lobstering or something that gets negatively impacted by tariffs. So hard to say, hard to say how long tariffs will last and what their overall impact will be on the macro economy here. But again, it's just more uncertainty, right? So when you add all of these things up, I feel for you all who are providers out there, because there's so much policy risk in the environment. Then, when you add on top of that, the Maine budget, I do think I believe this, or I wouldn't say it. I'm not just saying it to refute kind of what's been put out there, because it's true. I think it was a very fair characterization of the budget proposal, that essentially the big negative item in the budget is the suspension of the COLAs. That said, the governor's budget is a current services budget. And that is a huge accomplishment in this policy environment. The 1.6 billion that I referenced earlier, that is preserved, assuming the supplemental is passed and then the addition to the Maine Care base budget in the biennial budget is passed. That means we can continue doing what we're doing today. Is it ideal? No. We know that demand for service is growing. Inflation is much lower than it has been, but it's still there. So we understand the impact of suspending a COLA. These definitely hard decisions that, from our perspective, are far better than reducing eligibility or reducing benefits, which are the other options when you're looking at Maine Care. So that's kind of what I got. Happy to try to entertain any questions.
Thank you so much. And pretty gloomy.
I don't mean to be gloomy about it, but I also don't want to ignore it. It's there.
Oh no, yeah.
I mean, I'm one of those people who's not listening to news on the way to work anymore because I can't take it. But
I can't either. I'm right there with you, Paul. All right, any questions from the committee? Let's start there. Any questions from our guests? Okay, and then finally, we're going to take a break and say, I know we only have 3 participants listening, and I just want to, interested parties, I guess I should say, interested parties listening and let's just give a moment for them to offer any comment or ask any questions of the last 3 speakers.
Folks tuning in on the attendee side, you have a raise hand feature. If you raise your hand, I'd be very happy to unmute you and bring you in to ask any questions or comments you might have. I'm seeing no hands raised.
Thank you. Oh, yes, Catherine.
I have a question. It's not really fully formulated, so bear with me. But so I think when I think it's sort of going back to a little bit to what Arthur said, but for you, Paul, is the when I think about it with, I'll just talk about our agency and with our innovation grant, using like technology, and I know it goes back to what Brenda was talking about. I was on that work group she was referring to, but ways that we could, if there's less money or there's not enough money or there's not more money, are there ways and things that can be done in policy that makes services maybe more accessible where they weren't, offers a way to provide services cheaper, reduce the bureaucracy, reduce, I mean, I might have a long list of things that come to mind, but I think about, other than saying like, and other than saying, it's a bad situation and there isn't things we can do, I'm of the opinion that there are ways, I have a strong opinion that there are ways that services could be provided cheaper in certain parts of our system and service sector. or that the administrative burden on providers could be reduced. And so I was just interested if there's been any talk about that, and just that, people being served in hospitals, long hospital stays, and the cost of that on the system. It's harder for that to be tangible, but it is, that does cost the system of care, supports, and services when someone is living in an emergency room for 300 days, when they could be, served in another setting if that setting was available, or I know there's all kinds of statistics around that. So just curious from I guess from all of your perspectives, how much energy or desire, probably not the right word, but is there to be looking at other solutions when money is not per se available?
I mean, I'm happy to start, and you've hit a lot of different issues there, Catherine, and we're interested in all of them, to be honest with you. As you know, through the innovation grants, we really promoted the use of technology and remote support, incorporating a lot of that into our lifespan program. I think that's kind of a win-win for many people with disabilities, where the use of technology can actually give them a bit more independence and still maintain safety. And it is less expensive to deliver. So it's kind of a win all around. That we're definitely into those kinds of ideas. In terms of administrative streamlining, I mean, I would just point to the example of the new nursing home rate method that went into effect today, back to January 1st. We really reduced the administrative aspects of billing for nursing homes. It used to be that all of those costs were settled at the end of the year, which was a lot of work for the provider and for us, and also gave the provider a lot less flexibility, because you didn't know really what your year-end revenue was going to be until you settled up with the state. Now, we're paying a set price, and I mean, it's going to evolve over the next few years to transition smoothly. So, but it's just more transparent, cleaner, a lot less friction in the system in terms of the transactions that state and providers have to have. So we're definitely looking, I mean, as you know, we're in the middle of looking at rates for IDD, and we're looking for those kinds of ideas there as well. And we have some ideas that we hope to share soon. So absolutely. I mean, it's something we should do all the time, right? But we have more incentive and motivation to do it when money is tight.
Great. Thank you. It's good to hear.
Arthur Phillips, your hand is raised.
My hand was, I accidentally pressed another emoji, which was unintentional, but I just wanted to raise my hand to ask Director Saucier, or to say that I'm really interested in if there are opportunities for us to learn more about the state's efforts to implement the federal access rule, and really encouraged to hear kind of, how I think it sounds like you're thinking about that, regardless of whether the feds do in fact rescind that rule. So just curious if there are ways that we can collectively learn more about those efforts.
Oh yeah,
anytime in the near future.
Yep, I'll put a link in the chat to the webpage that we've set up on the access rule. We had several really well-attended webinars earlier this month when we formally kicked off the project, and there'll be many other opportunities along the way. We're definitely seeking support of interest holders in the access rule implementation. Our current scope of work is to come up with a roadmap of what it would take to implement it, because as you know, it's staggered over several years. And so like what comes first, what's most important, and how do we get that done? And that'll be ready by spring. So, but yes, I'll put that in for, we'd love for everybody to get involved in that work, and I'll put the link in the chat.
Thank you.
All right, I'm going to venture out. And I haven't been able to spend as much time as I used to in the world of legislation. But I have heard, I did not hear, so I'm gonna offer this by saying I might be getting this wrong, but I may have heard that there may be a suspension of the rate studies. Is that accurate?
You're asking me from a state perspective?
Yes. Yeah.
We have not said that we're suspending the rate studies. We've said,
Pausing, I think was the word I heard. Sorry.
we've said that it's unclear when the results of the rate studies can be implemented. And as you know, there is nothing assumed in the budget for implementing rate studies.
Okay, perfect. Thank you. Yep, that's interesting. Any other questions? Great. Well, thank you again very much for participating. The three of you, you can feel free to leave if you like, but we would certainly welcome you staying, but no requirement. And so at this point, we're going to get an update from Jaime on the state's effort to start work on a universal credential. So I'm going to pass things over to you, Jaime. And not start work.
Not
Move
start.
forward.
That's
It's
a
been
leading up.
going along quite a long time. I used poor words.
Now, am I in the presentation view, or can you see my full screen?
We can see your full screen. There you go. Beautiful.
Okay, great. Thank you. We all feel your pain, Arthur. Okay, so yes, this is an update on work that DHHS has been working on for several years, internal and external partners on the Worker Affordability and Advancement Initiative. So DHHS has created a baseline credential titled the Direct Service Worker course based on prior HRSA-funded work. The curriculum is to streamline entry to direct care and support workers across settings and groups of people, with the overall goal to provide a base level of training across intellectual disability, brain injury, physical disability, and aging service areas that address the core competencies that are endorsed by CMS. The course that we've developed creates a stronger training for those that work in Maine's aging population, currently referred to as PSS, and provides additional aging training to direct support professionals that work with IDT. And I know several of you that are on this call have listened to this talk before and looked at this slideshow. Our goal is to launch this DSW course and the updated DSP added training in the second half of 2025. Some of you, when we had talked previously, we had indicated July 1. The course itself is complete and could be ready to launch July 1. However, we want to be clear that that date is contingent on rule change. So it still could happen July 1. We're hoping for that, but just want to be very transparent with, you know, any barriers that we have along the way. I think this graphic here depicts a good understanding of going from what we have currently as the PSS training with this core curriculum, we're calling a direct service worker course, and then having a DSP add-on, which looks at the regulations and requirements for those workers that work with the disability population. Of course, our curriculum considerations here are always quality and safety. Our previous PSS curriculum was based on a small percentage of what is available in CNA textbooks. The new curriculum for the DSW is based on and aligns with home and community-based services best practices as outlined by CMS. The curriculum that we've developed is interactive with less reading. It is going to be translated into additional languages and have American Sign Language translation as well, closed captioning and narration will be on every lesson. And it's been reviewed by national and local subject matter experts, area providers, and interested parties. Again, I think we all have this shared goal of making sure that the training that can be provided across what our current curriculum looks like with PSS and DSP, there's a lot of overlap there. And so how do we streamline that training to make sure that the DSW course captures what is baseline for these workers and make it easier to transition if they decide that they want to obviously add more skills or learn a different population. This provides them that baseline to be able to take that training as a portable credential. This is a list of what the CMS core competencies are, and all of the modules throughout the curriculum include each of these core competencies. And there's not necessarily that ties to a direct module, but it is rather threaded throughout the entire curriculum. The structure is for 12 hours of online training with the 7 units. These are the units listed here that have those CMS core competencies kind of ribboned throughout each of them. I think it's important to point out here too that it also includes behavioral health throughout several of these modules, taking from core competencies. And then the intention is to have 8 hours live training as well. Now, the learning management system is something that we're working on as a state. We know this, getting the learning management system in place to be able to house the curriculum. You know, I think it's important that as people go through the curriculum that the units are in order. You can't jump ahead. You have certain screens that you have to go through and different quizzes for each module. There would be a certificate of completion upon passing, final exam of an 80% to pass. And then that will be vetted through the system as well, so that there is a way to ensure that the training has been completed and that training is done. As far as reviews, we think feedback is obviously critical to creating any strong training program. So as we move forward, learners will continue to be surveyed for feedback to make sure that we can do updates to the curriculum. Like I said before, we've had national experts as well as subject matter experts and provider feedback on the curriculum. And we currently are working to have the curriculum translated into ASL and the top 5 new Mainer languages. And I will pause there for any questions.
Do we have any questions for Jaime? Maybe first. Betsy, hi. Would you like to introduce yourself first?
Yes, I'll introduce myself first. I'm sorry I was late. I had another meeting at 1. I'm Betsy Sawyer Manter. I'm the CEO at Seniors Plus, which is an area agency on aging serving Androscoggin, Oxford, and Franklin counties. And I sit on this group as a service coordination agency, which serves the state of Maine. My question is, I think this is fabulous. I love that it's, the learning management system is really great so that people have the learnings in the order in which they make sense. I have a question though about where is this tied to by taking these additional courses and learning these additional credentials? Is it tied to some incentive of some sort? And what is that? Is it monetary? Is it a pay incentive? Is it, I know that there's the ability to move from population to population, potentially and work with a number of different populations, but what incentives are there for the workers to get that additional credential? Thank you.
I can take that if you want, Jaime. In the first instance, it's going to replace the PSS, which would be the one I think that you'd be most focused on, Betsy. And so the first incentive will be, if you want to work as a as a personal support specialist, you need to take this. Then the beauty of the core curriculum, once we get it in place, is that we can do micro badging, we can do add-on courses and expertise. There's already discussion going on with UNE about using some of the dementia-related credentialing that they're doing under, I think it's a HRSA grant.
Well, I believe.
Yeah, so then that could become an add-on. And but what we learned early on is that this is a huge undertaking. And so we've got to build the base infrastructure, which is that core course. And then we can build on that. We could add there might be other parts of the department that want to use the core curriculum, but there might also be add-ons that come with wage differentials, for instance.
Thank you.
And Catherine.
Yeah, I have a couple questions. You on the slide that you had, like, for how long you thought the DSW course would take, what for the DSP add-on, is there any information? I lost you on the screen. Oh, there you are, Jimmy. Is there any information on how long that DSP add-on would take, and will there be an additional live portion of that?
Yeah, the time frame is about the same. So the graphic that showed the PSS transitioning to this baseline DSW then has the DSP add-ons, which is around the same time, 28 to 30 hours, I believe, is what their goals are.
So total, it would be 40 hours for the so for someone to get a DS, be able to work as a DSP, they would have to do the DSW, which looked like it was 20 hours. And then they would have to do the DSP add-on, which was another 20 hours. Is that correct? Okay. And then how are current employees, I guess, like, a couple questions, I'll just add the questions that might roll into, like, how are current employees, current DSPs, current PSSs considered? Is there a rollout plan? And then last update I think we heard was that the learning management system was, like, out for contract or out for bid, and so just any, like, update of that, has that, and it was going to be like the state's learning management, the state was looking for a whole new system. I hope I'm saying something that was accurate, but that was my recollection. Is that still being considered for the learning management system? Are there any updates on that? And then I have a language question that I'll ask.
Okay. The learning management system, yes, correct. The state is looking towards one statewide learning management system. I believe we'll have some contracts with existing, like UMaine, in order for transition plan. And I think the rest of your questions are fabulous. We're looking for, partnerships and how we roll this out, what's going to work well for people. And a lot of these things we don't necessarily have tied up pretty with a bow yet, but it's, those are the conversations that we're having, and want to make sure it's a successful rollout. I think the quality of the training is what's really important, and then making sure that we've got the right rollout for providers and for workers.
And well, I guess I could just right off the top of my head say slow pilot with a smaller group. Those would be, and then if people aren't grandfathered, at least they're like, for the DSPs, they're like grandfathered in their transition of their 3-year research or something such as that. And then my last question is a very specific issue. And I don't, so it's one, like, I'm excited about this. I love the 5 languages plus ASL, and then, but we encounter, and this is weedy, but I'm gonna just take the moment to ask it. We encounter in shared living, host home situations, people who have a language that is not, that probably would never be something that would be translated, like Korean or some language that isn't so prevalent in our state, but it really is the language spoken in the family home. And so if they're going to provide services to their child, there is no real sort of issue there as far as needing to have English enough to be proficient to pass the DSP course. So like, are there resources for that, or is that something that can be considered along in the project of sort of these one-off translation challenges that sometimes people face?
Yeah, I mean, that's another great question. I'm not sure how we could incorporate the one-offs, but I know there are, systems available or resources, but I think that's a bigger conversation. Rather than just for this core curriculum and the rollout with the 5 languages.
I would love just a follow-up on that, just to understand. Oh, sorry, Catherine, you were gonna just to understand in a ballpark, like how much it costs to translate the curriculum, because I think about just knowing enough, right? I mean, we may need to, given all of the things that Paul talked about and many others, need to start recruiting, right, community members of people who need. As a matter of fact, we're really worried about the fact that we could have older immigrants in the state who, some younger person who's providing care for them gets deported. Like, how do we get someone else in there who can provide care? And it's sort of a strategy for providing people who don't speak English with care, is to recruit people from their community. But then how do they get trained if they're speaking a language that's not currently? So like understanding those parameters, like, so I'm not asking you to like answer it right now, but it'd be super cool to like say, this is generally how much it would cost. And so that if we ran up against this, we could say, okay, maybe we could go get $5,000 from, MEHAF, or 10,000, or we could ask them to, create a fund specifically for translation services, because this is something they really care about. So anyway, that's all. Just sort of understanding what the parameters would look like, because I think it's going to be more relevant as we move.
And I think it's, the cost, ballpark cost is something that we could get based on what we're doing now for the 5 languages and what that quote looks like. And the curriculum itself, the modules it has the narration in English. It has the translated portion will be written. So the spoken part of the curriculum is in English, and that's been shown to work really well for people that have English as a second language, to help them, kind of navigate the English portion of it and have the reference of their native language. But yeah, I think a ballpark definitely could be something that we could get for.
Any other questions from committee members?
I just have a quick question. I was curious, and I may have missed it. The funding for the LMS that you're looking for, how is that being paid? Only because I'm familiar with how expensive those things can be.
I can take that one.
I'll let Paul do that one.
So, yeah, just to be clear, DAFS, the Administration and Financial Services Agency, has procured a statewide LMS, so that is done. But we're not going to be able to use it right away because we're pushing the envelope. We want to use it with external users. And so we want every worker who takes the course to be able to create an account, right, and be able to track their learning, et cetera. Right now, the DAFS is focused on doing that internally with us. Like, did Paul do his mandatory annual security training, right? So first, internal use. While that's happening, we have a contract with the UMaine system to use their LMS, and we've been assured by technical people who know that when the time comes, we'll be able to migrate from all of the person data from the UMaine system into our state system when we're ready to use the state system. So I don't know how much it cost, Donald. I assume it was not, but it's a big step forward for the state of Maine. You can imagine, like, DOT, right, and their training requirements for workers on the highway versus everybody's security. I mean, the state hospitals and all of the health training they do. So it's going to be a huge step forward.
Great, thank you,
Catherine.
So the live classes, is it still, is the vision that it's still kind of gonna be a collaborative for DS, I don't know how PSS is, but for DSPs, it's gonna be a collaborative relationship between providers and the state, where providers are providing the live classes, kind of assigning people, doing all of that. Is that the vision, or is it more the not that it's a burden, but the responsibility is placed on the worker, and the live portion is something that's held by somebody in state government?
It'll be a partnership with the providers.
Anyone else on the committee? All right, going to friends and relatives. Brenda, you've had your hand up.
I was just wanting clarification on current workers and how this new curriculum rollout would impact them. And it's my understanding, I just want to make sure I've got this right, that it hasn't been set yet, hasn't been determined yet. And Catherine's suggestion that they be grandfathered is not out of the realm of possibility, at least in the beginning.
Yeah, there's no definite yet for what that transition looks like. But we want to make sure that the workers have what the most current curriculum is, and they have the most current patient-centered learning. And so more to come on that, but.
Yeah, I mean, I would even go a step further here and say that we do need to work out a transition for currently certified workers. So that's understood. And we don't have a definite idea about that, but we'll be looking for input. It's going to have to be addressed as we amend rules, right? All of these curricula where they're required are in state rules. And those state rules are all going to need to be amended. And that's why it's going to take us a while to actually implement this and what the transition looks like. But I would go on to say that we just feel so strongly that workers also need continuing education over time. And so once you do have the certification, what's the requirement for refresher courses or add-ons or, so we'll be addressing all of that too.
Any other questions from our guests? All right, we'll take another pause and see if we have any comments or questions from our audience at home. You can just raise your hand. Okay, hearing none. Thank you very much. And again, Jamie, you're free to leave if you've got other pressing business, and we would certainly welcome you to stay. So we're going to move on to introduction to our newest association and have Renate and Bev tell us a little bit more about the Maine. Well, you're going to tell us about your new associations.
Okay.
We get it wrong.
I'll
Personal
start.
Care Agency, right? Maine Personal Care Agency Association.
Maine Association of Personal Care Agencies. And I feel
Oh,
like some of you guys have been hearing this several times over recently. But first, I just wanted to jump back. I didn't raise my hand because I knew I was going to speak next. But Jamie, I'm so excited about the new training coming. I haven't actually been able to, I was not one of the people that reviewed it, but I've talked to people who have, and I've only heard good things. So very excited for that coming down the line, especially that interactive part, not just reading for hours on end. It'll be fantastic. So, as a lot of, most of you, I think I've met in some form or another. My name is Renate Scholz. I've been in this business for about 10 years. I was a teacher before that. I've owned the Homestead franchise in Gorham for a year now. I know it's been a year, Jess. I saw that face. And during that time, we, as a lot of you know, prior to last summer's, personal care agencies were registered, not licensed. And I think the licensing thing was far overdue. I think it's a great thing. I think it elevates home care as part of the home health continuum. And I think it will help to ensure that older adults in Maine across the board will be getting quality care. Along with that, though, personal care agencies in Maine have never really had their own association. There have been associations for home, all the whole blanket of home health and hospice and everything. And there have been national organizations, but there has never been an association just for home, for PCAs in Maine. And so in the whole navigating the new licensing rule, a lot of us started talking to each other a whole lot more, and realizing that it was a really great way to share information amongst ourselves. Because I mean, I imagine that all of your email inboxes look similar to mine in that things get missed along the way, and there's a lot of information coming in all the time. And so to have an association that can kind of go, weed out the things that are important to all of us is really important. So is really helpful to all of us, to me anyway. I'll speak for myself. So we're pretty much brand new. We're still trying to build our membership. We're still trying to figure out exactly what the most important things are to our members. We have members that are both personal care agencies that only take private pay or long-term care insurance. We also have members who take Maine Care or veterans benefits. That's the whole different ball of issues right there. But I think across the board, the thing that that really unites everybody that's in this group is that we're all trying to figure out how to provide the very best care possible, and keep, for those of us taking private pay, to keep the rates as low as possible so that as many people can afford it as possible. And at the same time, to be making sure to be paying our workforce even a fraction of what they deserve for what they do. And so that's the balancing act, right? I mean, that's constantly what we're doing. How can we attract people? But it's not even just about attracting people. It's about elevating what they're doing, because it's so important, and it's huge. I see, we had a retirement lunch just now for one of our caregivers, and just the lives that she has touched in the time that she's been a caregiver with us, it's just remarkable to hear her stories and the love that she has for all these people that she's worked with. And so they deserve so much more than we can possibly ever pay them. So that's, I guess that's it, like how do we share information amongst ourselves? How do we find those resources that we all need in order to make this work for all of us? And every one of us is actually affected, even if we don't take Maine Care, by those reimbursement rates, because that, if we want to have caregivers, if the reimbursement rate goes up, if we want to have quality caregivers, we have to pay more as well. So we're all intertwined, and we're all working towards that same goal. And I'm sure I had more things to say, but I didn't have wonderful slides because we're new. We don't have slides yet. Bev, what would you like to add to that?
We don't even have a logo yet. We don't have
We're working on it.
I don't think the Secretary of State recognizes us yet. We're very, very close. So I can just talk about this from the outside perspective, because I don't have a personal care agency. I don't work for a personal care agency. I work for all of them. In this process, I mean, my background is in, I love government stuff, figuring out how we make the world better, how we make the state better. I'm also a business person. And when I think about the work that the folks in personal care do, it helps elevate people's health. It elevates their happiness. It elevates their connection with family because they get to stay in their homes and their grandkids can come to visit. There's a whole lot of pride in the work that they do, and we're just trying to make it better across the board. So kudos to Renate and all the other folks who own the personal care agencies. Obviously, yes, today we're talking about workforce within that role, but that workforce is vitally important for a lot of reasons in this particular small segment of the entire continuum of how we take care of people.
And I think, as we grow and as we become more, a lot of our members already are involved with a lot of different things. Our secretary on our board is Jeff Johnson, who I know has served on some of the workforce work groups. And so, we want, I think I can speak at least for the executive committee that we would very much like to be a resource for other organizations as well down the road. And that's all I got, Jess.
Thank you. I will say that I'm excited for this association because as we talked when we met, one of the pieces of information or data that we do not have and we don't understand even a little tiny bit is what the demand, the unmet demand is for folks who are never going to qualify for state funded or federally funded home care services. And because, as you mentioned, Renate, there's really this price point issue. You can only charge so much until you charge yourself right out of any business. That there's always going to be a sweet spot of what has to, where the fees are and how many workers you're going to be able to have. And so then there's the question of who can't afford home care, who can't afford to pay out of pocket at all and isn't getting care and is at risk of, again, avoidable, healthcare utilization and or this is where, sort of gets into the friendly neighbor and fraud and abuse and neglect cases we see increased by people who have to rely on other people for their care and support. Anyway, I'm not even going to go there, although I will say, we've seen documented cases of it goes from I'm going to get your mail to I'm going to borrow your debit card to I'm sexually assaulting you. And it's, these are the things that happen, unfortunately, when we don't have like a really reliable system of care and support. Then the other piece, right, is how many people are on wait lists to get care, but nobody maintains wait lists. So these are issues we just don't understand what sort of the unmet need is out there and what happens because we've been focused mostly on state funded and federally funded programs. But I think it's just a question I have and one we're going to try to pursue. So thank you. And then any questions? Bev, did you have something?
I was just going to say, so I'd love to send you all our website. We don't have one yet. I did throw my email into the chat. So if folks want more information, I will point you to our website as soon as we have one.
And we are planning on having a newsletter ready by the end of this week. So
there you go. Happy to put you on my list.
Great, terrific. Well, thanks for coming today and saying hi.
It's been great to listen into and hear everything. And so I have learned so much in the last year that it's really warding off all of that dementia. I'm learning new things all the time.
Yeah. That's my plan. Just keep doing this work and we won't have to have dementia, right? So Nichole, we're going to have you come along, and you've just issued a new report from your summit last year, and would just love to hear any updates that you have from the Direct Care and Support Professional Advisory Council.
Sure. Thanks, Beth. So, as Beth mentioned, we issued a new report last year. It's called the Direct Care and Support Professional Advisory Council. It's a report that
Yeah, I'm just working on sharing my screen here. Does this look good to everybody?
Great.
Perfect. Well, thank you so much for having me here today. Unfortunately, Brenda Gallant, our Executive Director of the Ombudsman Program, couldn't be here today. As many of you know, Mercy Home in the county is closing, and so she's diligently working on that closure today. But she wishes she could be here. So I'm just here to kind of give a brief overview of the report, but I wanted to just give a brief background of the council. So Maine's first direct care and support profession, and of course, I'll introduce myself. I'm Nichole Marchesi. I'm the public policy advocate for the Maine Long-Term Care Ombudsman Program. I've been with the Ombudsman Program for 8 years in a variety of different roles, but I'm happy to support the council in its mission and goals. So the Maine's first direct care and support professional advisory council, many of you know, was established in February of 2022 to really create a strong collective voice that offers expertise and guidance to policymakers and legislators on key workforce issues and initiatives. Council membership represents the diversity of Maine's workforce, so members are employed across all long-term care services and support settings, and Stephanie Hatcher, who's part of the committee, is also a council member, so I just wanted to provide that recognition today. And so, yeah, within the small time that the council has been established, they've done a lot of work, really a lot of level setting, building awareness about the council, just really amazing things. And I'll pop the council website in the chat after this so you can read the council news. We try to keep that updated on all the amazing things that the council has been involved in. I'm very grateful to be able to support the council because these individuals providing care each and every day are really amazing, inspiring individuals. So as Jess mentioned, we hosted a conference on September 17th. And this was called Uplifting the Voices of Maine's Direct Care and Support Professionals. Over 120 direct care and support professionals, policymakers, and other experts convened in Hallowell, which was an amazing turnout. We were so excited to have this many individuals together in one room, really talking about the challenges that face direct care and support professionals each and every day, but also to look at suggestions and recommendations on how we can better support them in all the work that they do. There was a panel of experts, many of whom are on this call today, and we're thankful for that partnership and continued partnership to support the council. And then we held roundtable discussions to really hear directly from the workers, which was really an amazing part of the day. We had 20 tables, and it was a pretty packed event and report out of what those individuals heard at those tables. The conference was successful overall. In the report, attendees exhibited high engagement and enthusiasm around the event and what the future of this event could look like for another conference in support and next steps. So I don't have a whole lot of time today to kind of like go over the whole report. This report was done in partnership with the UMaine Center on Aging, and we did do an official launch of the report in early January, which really highlighted the whole aspect of the report. And so I'll drop a link in so you guys can review that as well. So just kind of the key outcomes of this report. We know pay and benefits is a primary issue. This comes by no surprise to many of you on this call. Day in a life awareness, really wanting to provide awareness on what it looks like for a direct care and support professional each and every day within their role. Awareness of the need for improved staffing, because we know that this would help retention. Primary motivation of staying in their jobs is the relationships they build with the residents and family members. Interest in exploring options around innovation around options around benefits such as childcare vouchers and housing subsidies. So that was a huge interest, and improved staff training. These are just really a couple key outcomes. The report really covers a really in-depth overview. And so, like I said, I'll drop the link in the chat so you can really look at the charting of everything that came out. The UMaine Center on Aging did a great job really encompassing everything. Really next steps post this conference is we continue to remain in communication with all the attendees. So all the direct care and support professionals beyond the council. We are sending updates on what's going on this session, how we can help support direct care workers and support professionals. We're really expanding the council and the activity. We will be providing testimony this session on workforce-related issues. Brenda talked a lot about the speaker's bill. We're strategically planning on how we can support that and the best efforts to bring forward that bill. In the day in the life videos, this is a great outcome of the conference. It was one of the key recommendations they wanted to see. So Angelina, thankful for her and all her commitment to really be able to provide funding through the Department of Labor to see these day in the life videos come to life. I know Michael Smith, also on this call, has been a key partner in that. So we are in the works of really seeing the progression of these day in the life videos yeah, sorry.
Are you advancing slides?
No, sorry. No, it can be a distraction. I just did placeholder slides.
You know, if you were, I'm so sorry. I just wanted to make sure if you were like showing us something cool that we weren't missing it. So keep going.
No, nothing cool. I just did placeholder slides. But I'll stop sharing so it's not a distraction. Yeah, that's really all I have. I didn't want to take a lot of your time today. I thought I could really drop the report in the chat and you guys could take the time to review it. But we're really excited about all the partnerships, the partners that we have on this call, but also outside this call, and just continuing to work on the mission and goals of the council. Brenda granted her presentation before HHS committee, and we were able to bring 6 council members to that to introduce themselves to the HHS committee, which was wonderful. I know Stephanie Hatcher coming up this week and the next week will be doing a lot of testimony in support of different bills and COLAs. A lot of talk about the COLA that Brenda mentioned. So really just excited about what the council is going to be doing this session.
That's terrific. Thank you so much. And then any questions for Nichole? And any questions for Renate, Bev, or Nichole from our listening audience today? Thanks for the report. All right, hearing none, then I am going to ask Kim. She's like me. What are you talking about? If you had any reports from DOL that you wanted to offer, any updates, sorry. And you don't have to, because I'm putting you on the spot.
Good. Yeah. I did, I believe I submitted a written report just looking at the packed agenda for today. So hopefully everybody has received that. I'm looking at Angie. Angie doesn't know that though. Did they receive? Okay, excellent.
Everyone should have received it via email, including those who are among the interested parties. But if folks didn't get it, I'm happy to resend.
Awesome. Thanks,
I
Jess.
did. I just wanted to give you the option of offering any updates because you're
no problem at all. Thank you.
All right, great. Okay, so then the last question I have for you, and I can't believe we got through this in 2 hours, which is really fabulous. I'm going to give you like an entire hour of your day back, which is unheard of because I actually lost an hour already today, so this is good. But before we go, I do want to ask, and I started by reading our powers and duties of this committee. Did anybody hear anything today that made them say, oh, this committee should make a recommendation, or we need more research on, so we should suggest some things should be collected. And again, nobody has to speak, and we can also make sure that I'm going to keep doing this on a regular basis now, which is to say, want to make sure that we're thinking about our powers and duties appropriately. So just want to basically leave a little bit of time here to just say, does anybody have any reflections from the meeting today that they're thinking we should think about building something out or making a recommendation or getting more information? I know you're all just saying, I just want to go. All right. Well, I haven't heard anything. And then I just want to say thank you all. Catherine, do you have any last words you want to offer?
No, you got it covered. Good job, Jess.
Great. Well, have a happy rest of your Monday, and hopefully this week will be a little less wild, but I don't know, than last week. And so keep your seats. That's what I like to say, and be okay in the middle of the storm, and we're all going to be good. So so it's nice to see you all. We'll see you again in a few months. Thank you. Have a great day.
Thanks, Jess. Thanks, everybody.
Thank you for